Well, as we've heard, the COVID threat is to be raised to the highest level 5 across the UK following a warning from all 4 chief medical officers that the health services are at risk of being overwhelmed within 3 weeks. With coronavirus cases continuing to rise rapidly, driven by the new variant of the virus, the number of COVID-19 patients in hospitals across the UK is also increasing sharply. Our health editor Hugh Pym has the latest for us.
On the front line of a major London hospital today. Here at St George's, staff say it's exceptionally busy after a big increase in admissions of COVID patients. Over the weekend, they've been struck by the number requiring oxygen support, and that's meant doubling capacity for oxygen supplies, which is no easy matter.
We have had several whole families admitted. Quite a lot of those people haven't been older people. They haven't been people with lots of medical problems. They have been young and fit people who have been themselves shocked at how unwell they've got and how quickly they've become unwell.
Annabelle's whole family was struck by the virus. She and her mother Maria were struggling to breathe and were admitted to Leicester Royal Infirmary. They were brought together in intensive care, but less than 24 hours later, Maria died.
It's literally just torn my family into tiny pieces. I understand everyone's situation is different and we are at different points in our lives. But just to take a moment to put yourself in my shoes, and if that would make you perhaps rethink what you're going to do that day.
London hospitals are under extreme pressure, and it's the same in other areas of southern England. In the southeast, total COVID patient numbers in hospitals are now well above where they were at the peak last April. And it's a similar story in the east of England, with patient numbers rising rapidly in recent weeks. The chief executive of the Countess of Chester Hospital said 40% of beds were occupied by COVID patients and stressed there was a problem affecting more areas than just London. Community leaders in Cumbria, meanwhile, warned that the situation was getting worse.
It's extremely serious. The risk to the hospitals in the north is quite severe at the moment. They have more coronavirus patients in the hospitals than they have ever had.
In some parts of London, virus cases as a proportion of the population have gone up 25% in a week. That's why hospitals like this one are under increasing strain. And at a time when there are higher levels of staff sickness and those needing to self-isolate, things could get even tougher in the weeks ahead. Hugh Pym, BBC News.
Hugh Pym is here. We've been talking about the measures, Hugh, but it's worth reminding viewers at this point, before these come into force now in many areas, what's led to this, the state of affairs that's led to this.
Well, Hugh, the UK's 4 chief medical officers have made it abundantly clear that without some sort of action, the NHS, in their own words, in some parts of the country would simply be overwhelmed in 3 weeks' time. And just looking at some of the figures, that underlines that message. In England, we haven't had figures for other parts of the UK yet for today. More than 26,500 people are in hospitals in England with COVID-19, up 3,000 in just 3 days, and up nearly a third in a week. And remember, these are people who first got the virus maybe 2 weeks ago, and then, unfortunately for them, have ended up seriously ill in hospital. The current case increases we're seeing, newly reported cases up by 50% week on week. Some of them will become seriously ill, sadly, but that won't come through into hospitals for another couple of weeks. That's the pressure already in the system, and lockdowns will take a little time as well to take effect. So hopefully, as last year, March, April, lockdowns will bring down the case numbers. But with this new variant, some experts are saying tonight, we can't be totally sure how long that'll take.
OK, Hugh, once again, many thanks.